Okay, so I also chose option number 6. So we'll start with cranial nerve number 1, which is the olfactory nerve, and the function is smelling. And to test that, we can have a patient test different types of odors and see how well their sense of smell is. Cranial nerve number 2 is the optic nerve, and the function is sight and vision, and we can use something known as the Snellen chart to see how well our patient can see. Cranial nerve number 3, the oculomotor nerve, is the movement of the eyeballs and eyelids. To test that, we can have a patient follow a pen and see how well their eye movement is. Cranial nerve number 4, the trochlear nerve, the function is to move the eyes inward and down and inward. So we can have the patient follow a pen as well, and once again, see and study how well their their movements are. Cranial nerve number 5, the trigeminal nerve, the function is sensation to face and facial muscles. What we can do is take a Q-tip and drag it on a person's face and see how well their sense of sensation is from the Q-tip. For cranial nerve number 6, the abducens nerve, the function is for the eyes to move laterally. Once again, we can grab a pen, move our pen laterally, have the patient follow it with their eyes, and see how well they react to that. Cranial nerve number 7 is the facial nerve, and the function is supplies muscles of facial expression. So what we can do is have the patient blink and see how well their facial expressions and muscles are working in that area. Cranial nerve number 8, the vestibular nerve. The function is hearing and regulating balance. So we can test this by either whispering in a patient's ear, snapping, and seeing how well their sense of hearing reacts to that. And cranial nerve number 9, glossopharyngeal, is taste and swallowing. One thing we can do is have a patient taste numerous amounts of things, see how well their sense of taste is. We can also have the patient say ah and check for their palatal and things like that. Cranial nerve number 10, the vagus nerve, the function is the parasympathetic supply to the eye, heart, gut, and eyes, heart, gut, and lungs. We can test this by either testing it by the gag reflex, by maybe putting a cotton swab on the back of a patient's throat and test how well they react to that. And we can also have them say ah and just check inside of their mouth. Cranial nerve number 11, the spinal accessory nerve, supplies SCM and trapezius. What we can do is check the strength of the trapezius by maybe having them do various amounts of exercises and see how well it reacts to those. And last but not least, cranial nerve number 12, the hypoglossal, is responsible for their function is tongue muscles. So we can have a patient stick their tongue out, move it up, down, side to side, and see how strong their tongue strength is.